Was that a yes, Mira? Okay. Okay, so give me a thumbs up when I'm ready to go, Whitney or Holly or whoever.
You should be good to go.
Okay. So we'll run through the surveillance report, throw it to our partners to make comments if they have any, and then open it up to questions. Bear with me a minute. Oops. Sorry about that, folks. I'm having a hard time getting my screen share to work. Hold on a minute. Okay. Still hear me okay? Okay. So here you'll see our surveillance report. It's up on our website as you saw me painfully try to find it. You can see our 7-day rolling average of cases has dipped below 25 for the first time in a while. We're just barely below that at 24 cases per 100,000. That's good, a good sign. Nothing is guaranteed though. We're just barely below that threshold. So we really want to see that continue. We're finally getting back to that point where we were shortly before spring break. We're hoping that trend continues, but like I said, there's not a lot guaranteed about that. We still continue to need the community to continue to exercise those social distancing, wearing face coverings, those kinds of things that help us get these numbers lower. And why these are important is the more cases we have, as I've said many times in the past, this is a numbers game. The more overall cases we have, the more chances we have at hospitalizations and the more chances we have at deaths. I know we had announced another death within the last 24 hours. We have people in the hospital right now, people in critical care right now. So not an overwhelming number, but still for those people and those families, it's significant and it's pretty concerning. We'd like to do what we can to prevent other families and other individuals from having to go through that. And that's where we can all do things like that, keep that social distancing going, continue to wear face coverings, continue to do those sorts of things. Our case positivity has really been pretty hovered right around just above or just below 10%. You really want it to be below 5% is optimal. We're at just about the same thing where we were last week. That's kind of held pretty steady. We'd like to see both of these numbers go down over the long term. We continue to be an outlier in the state in terms of the number of cases and our positivity rate. We lead the state. I don't think there's any county with a higher number than we have right now. Testing, continue to get specimens back lickety split. We're not seeing a problem getting our test results turned around, which is good. Again, once those specimens are collected, the most of them are being received to public health within a day or less. And very few are taking longer than 2 or 3 days. And we get those investigations started pretty quickly. I will say we are somewhat limited in the extent to which we can do those investigations when the numbers are fairly high like they are right now. And the impact of contact tracing is significantly less when you have a higher number of cases. You can see onset date and the higher number of people who were reporting symptoms. These are people who have been diagnosed with the disease. And you can continue to see the number of people in different age groups, and people in their 20s really continue to lead the pack in terms of driving transmission, driving our numbers in Gallatin County. Although they're not the only ones. It really is across the board. But you can see these increases in people in their 20s, and if you look at that in a more confined time frame, you can see this even more dramatically. MSU continues to report a relatively reasonable number of cases, 11 new cases during the last reporting period. Of course, MSU is really going through a change in the situation due to the end of their term, students going home, fewer people are on campus, those sorts of things. Just keep seeing cases associated with schools, and the number of beds available remain decent. I would say we continue to see between 5 and 10 people in the hospital on a day-to-day basis, some in critical care and some not. And so we're going to continue to keep an eye on that. So with that, I will throw it to Kallie. Kallie, do you have anything else to add?
I really don't, Matt. I have, relatively same information. Just really wanted to stress that we are allowing individuals to schedule appointments to be vaccinated for their second shots, even if they got their first shot elsewhere. And we're doing a combination of first and second doses during our clinic. So no more restrictions there. And, we just really echo with our census going up with COVID positive patients and our bed occupancy creeping up a little bit. We just really encourage folks to continue social distancing, proper hand hygiene, and wearing masks and face coverings, as you've stressed already. So thank you.
Thanks, Kallie. Tracy.
Yes, today is the last day of classes, so it will be very quiet next week, and we couldn't have gotten through this year without the help of Gallatin City County Health Department and Bozeman Health. So thank you very much.
Thanks, Tracy. I would reiterate again what Kallie talked about with regard to the vaccines. We now have enough vaccine. We have available appointments, both at the county site at the fairgrounds, as well as Bozeman Health. Community Health Partners is running a clinic today. We've had clinics going in Big Sky, in West Yellowstone, throughout. As I've said before, now is the time. We need people to take advantage of the availability, to take advantage of the resources that we've built to be able to distribute these vaccines. We won't be able to sustain a level of administration capacity that we have right now. And it takes several weeks for people to get through the 2-shot series to build that immunity 2 weeks after their second shot. We're headed into a busy summer here in Gallatin County. There's going to be, tens of thousands of people coming in from all over the country. That will create challenges that similar to the ones that we saw last summer. And so the more people that we can get vaccinated, the more we can protect ourselves. And for individuals, starting that vaccine series now will allow you to better protect yourself if we get into a situation later on this summer where we have a higher number of cases. With that, I would open it up to questions.
Tracy, excuse me, I have a question for you. It sounds like California State University and University of California has announced that they're requiring teachers and students to come back vaccinated in the fall. Is that something that you guys have talked about in the Montana University system?
So my understanding is that the Montana Board of Regents will be talking about COVID university-wide issues at its May meeting, which is the 26th and 27th of that. And so if there was anything like that, it would be adopted at a university system-wide level by the Board of Regents. So Office of the Commissioner of Higher Education is probably best to answer that question.
Thank you.
Other questions out there? Boy, quiet bunch today. Other questions? Anybody?
None from me. Thank you, Matt.
Okay. All right. I think that's all we've got then today. I will say that next week, the Board of Health will be meeting. We're trying to understand the implications of some of the legislation coming out of Helena this week. I will say, in some cases, I'm confused. We're really feeling kind of whipsawed by some of this. We had, for a long period of time with HB 121, we had the sponsor of the legislation and the governor's office saying that the intention of that public health legislation was to put local elected officials in charge of decisions related to COVID. The governor's office put out a statement on the 16th saying that ensuring that appropriate elected official oversight and safeguarding the discretion of local public health officials. What we're dealing with right now is HB 257, which appears to be headed to be signed into law. And the way that we're reading that right now is that it really eliminates any meaningful local control over community level efforts to control the spread of COVID-19. The new law seems to move control over those decisions to people in Helena rather than local leaders. And that's concerning. We're seeing, for a number of reasons, we're seeing with the advent of this legislation, a pretty significant change in activity that's happening in some of our licensed establishments. I took a walk around our licensed establishments on Friday, and I'll tell you what I saw was in some establishments, not all establishments, was pretty concerning. I'll just say and what HB 257, the big concern is HB 257 potentially takes away our ability to deal with those at all. Some of the things that we were seeing, I mean, this is a picture that I took at Bar 9 on last Friday night. This is a picture I took at Rock and R Bar the same night. This is a video that I took at El Camino. This is another bar downtown. And again, this is what we're seeing in our epidemiology. We're seeing that the growth in cases in Gallatin County is being driven by people in the younger age groups. And that, time I spent walking around the bars downtown takes a little bit of mystery out of part of the reason why that is. HB 257, I think, essentially guts our ability to deal with that locally, and takes that authority away to deal with those kinds of situations. Seems to put a priority on the ability of bar owners to sell liquor to 20-somethings over public health concerns, and that's concerning to us. We'll see where this goes. There seem to be other implications on this, but this is new to us. We're still trying to get our heads around what all this means. But I will say that now is the time to get that vaccine, because as we have more tourists, as we have less ability to deal with the local circumstances, we may see an increasing number of cases. We may not. I hope we don't. But it's a concern right now. So with that, unless there's any other questions, I will let you all go. All right, thanks.